Hello everybody. Following on from my talk about kids with breathing problems, I thought I'd talk to you about adults. Here's a question to ponder. Name a medical condition where a lifelong prescription of treatment is made without the patient being examined as to finding out the cause or reason that they have the condition that's being treated. And the answer to that I'm aware of is only one, and that is obstructive sleep apnea. Obstructive sleep apnea is where patients are stopping breathing at night due to some form of physical obstruction to their upper airway. And whilst there is a test for this called a sleep study, which will measure how bad the blockage is, unless someone actually examines the area, then you truly have no idea what the cause of the problem is. That's where an ear, nose and throat doctor comes into play. And the reason that's important is because sometimes the blockage could be due to a tumour. Now, that's not to be alarmist, but it is a reality. However, most of the time we find problems that are actually quite easily to manage and potentially reversible with surgery. So, for example, if your sink was blocked and you called the plumber out, you would expect them to look into the sink and look into the pipes and find the blockage and try and clear it. And once it does, that's been done, things work better. However, with sleep apnea, we have people basically put on a pump. You wouldn't expect the plumber to turn up, look at your sink and go, look, I just need to put this pump on it and just let it pump stuff through and it'll force it through the blockage. You wouldn't be happy with that solution. And yet we treat patients who have blockages in just that same way. So from an ear, nose and throat point of view, we can obviously rule out a tumour, but we can also make sure that the nose is clear. We can make sure the tonsils are not too big. We can make sure that there's no swelling at the back of the throat that we can possibly shrink down. And speaking of shrinking down, a lot of people are surprised to learn that we can actually shrink the tongue down. So if the tongue on the inside of the mouth is too large, we can shrink it down and open up more space. It actually works really well. It's called a coblation tongue volume reduction. Now, before you jump off into Google and YouTube, be aware that there are different variations of this procedure. And the one that we use here is the minimally invasive one. So if you want to know more about this procedure or anything else, then of course come and speak to us here at ENT Specialists. The other thing we can do though is in assessing patients is we can see if possibly a dental appliance known as a mandibular advancement splint might actually help or work. We can have a look inside the throat, we can see if the throat is collapsing, and also get you to move your jaw forwards like a splint would to give some sense of whether a splint might actually be a useful option for you too. We actually find that we can get a lot of patients better. We may not get them perfect, but we can get them better enough that between surgery and a splint, that's all the treatment they need. The other thing that's often overlooked is weight, and certainly being overweight is not good for sleep apnea, and we just certainly encourage weight loss as part of the program. So that's adults in a nutshell. So if you've ever been diagnosed with sleep apnea, can I encourage you to do one thing? Ask your medical providers, why have I got it? If they tell you it's because you're overweight, they may be right, but there may be other things going on. If they tell you it's because your tongue is falling onto the back of your throat, well, look, I've got to be honest with you, that is knowledge or information that we've moved on from long before now. Many patients actually don't swallow their tongue. It's not their tongue collapsing on the back of their throat, blocking things off. That was a very old school paradigm. It makes for an easy explanation, but it's also a lazy explanation. We are living in the world of precision medicine. We have the ability to precisely assess your anatomy, work out what's going on, and give you advice and direction as to what will and won't be in your best interest in terms of surgery, medical therapy, CPAP, splints, and the like. So for a professional assessment of your upper airway obstruction, you need an examination. And certainly at ENT Specialists, that's one of the areas that we focus on strongly. So please, again, share this video far and wide. We want as many people to know as possible that there is no need to put up with obstructive sleep apnea, and that we will actually look and give you an explanation as to why you have the problem. And that's something that a sleep study simply can't do. Sleep studies are important, but it's an investigation. And in all medicine, otherwise, we take a history, an examination, and then decide on what investigations are appropriate. This is the only condition where we jump straight to an investigation with no clinical assessment. And when we find the disease, we don't even go and ask, well, why have we got it? So again, if you've been diagnosed with obstructive sleep apnea, you need to be asking the question, why? Thanks. Bye.